Welcome back to another episode of Inside Access Control, sponsored by SIA. Very excited today to have Brine Hamilton join me. Brine is a expert thought leader, creates a bunch of really great content lately that I was introduced from Sarah Lawler Moskowitz from the Innovation Nation side of things, and really excited to meet you and work with you and talk to you. So thanks, Brine, for making the time.
My pleasure, Lee. Thanks for having me on.
Yeah, absolutely. So you're in the healthcare side, security, access control. We'll dig into that, but why don't you give a little background on yourself? What got you into the industry? What do you focus on now? And then we'll jump into the specific vertical and what you're viewing and seeing.
Certainly. Well, 15 years ago, I got into the security industry, and in my first 2 years, I was working, in the retail environment, and I ended up getting a site supervisor position. But then an interesting opportunity opened up in the healthcare vertical. So I applied. I was successful in getting in, and I got my start as a frontline security guard at a hospital in downtown Toronto, recognized as one of the most diverse cities in the world. So a lot of valuable experience there in so many different facets of just the industry and just really communicating with people of various backgrounds and perspectives. So I worked there, worked my way up through the management ranks. Currently, I'm working with Gardaworld as our healthcare security specialist and operations manager, working out of Southwest Ontario, Hamilton specifically, and just serving our healthcare clients. Now, on top of that, I also host a podcast that focuses on healthcare security, the Healthcare Security Cast. I release at least one episode a week. Aside from that, I also teach at two local colleges, Fleming College and Seneca College, teaching security-related programs for diploma programs there. And feel like I am missing something significant, actually. I'm a board member with the International Association for Healthcare Security and Safety. So it's a professional network for individuals involved in the healthcare security industry. So right now I'm serving as a member at large, and I'm just finishing up my second year of my term right now.
Outside of that, nothing. That's good.
Outside of that, I'm a husband and father of four.
Wow, good for you. Oh, it's impressive, and I love the journey of, you started actually practicing this and doing it, and then sort of it's taking you on that end. So definitely deep knowledge on that end. So thank you for that, and I appreciate the approach that you take with it. And like I said, well, the content you put out, I watch it, and it's great, and it's your approach to it. And really, what it shows me too is it sort of carries on. I'm seeing, at least in the access control side, this verticalization and sort of expertise, but then also this ability to have sort of broader conversations. So you take inputs from other areas is really being sort of where the industry's going. On the healthcare side, what are some of the trends and what are some of the, what's classically, COVID happening? I mean, that besides COVID, what are the effects, if you would, of some things that were happening before that maybe are accelerated now, some new ones, but then even some that have drawn off? What are you seeing?
Well, the one thing I'll say is the one biggest thing, and it ties in well, is just access control. That's been a huge thing. Now, in the last decade, a lot of hospitals have really made that change to the patient-centered care approach of 24/7 visiting hours, and really having, even though we were controlling access, generally you're controlling the number of entrances that are open after hours and the ways that people can get into the facility, but you weren't really preventing people from coming in at any given time, with a few exceptions here and there, depending on different factors in different units of the hospital. But now with COVID-19, we've really seen that, you can really control access and still have successful operations within a healthcare facility. And you can see we went from 24/7 with, very, very limited, very light restrictions on visitors, to most facilities going to no visitors at all, or a limit of one, even in the most dire of circumstances for people. So it's really caused a shift that way, just how we do access control and visitor management. So that's been one factor. Some of the things that tie into that as well are just the temperature screening. You're seeing a lot of technologies that are being used to leverage that. And there's a mixed set of opinions on that, but yeah, I see you laughing there. But yeah, there's a different set of opinions on that. I haven't had to experience that at any of my facilities. The ones that I'm managing don't utilize it at all. So
I have. It's an awkward experience, and you could tell that it's one of those things that you just know, like, that you can't imagine that this is going to stick for a long time, except for certain use cases, or it's going to change to where it's done in a manner that is a piece of a much larger experience, right? Versus this sort of right now, it's like stopgap. Everyone threw hammers at it and was like, get it in and do it. It's like very weird. It's very weird.
Yeah, and you actually mentioned Sarah earlier, and Sarah introduced me to the technology that's being leveraged at a number of facilities.
Yep.
With the facial authentication. So that's been another factor as well, and even as far as doing some really cool things like being able to recognize somebody when they have a mask on, and being able to deny them access if they don't have a mask on in an area if they're going into an area where it's required. So yeah, a lot of different technologies being leveraged during this time.
Yeah, absolutely. So talk about a little bit, throw some concepts and ideas actually from the healthcare side that you talked about, and just some observations I've had. So if you talk about the visitor side on that end, and the sort of limiting amount of people that can come in, where before it's like, the door would slide open, you'd walk into an area and then they'd be protected beyond that. But now that's sort of extended now to the door that opens, right? And I'm interested to a couple things. Number one, that experience, I can't imagine is going to last like that, right? I know my father just had surgery on his shoulder, and my mother couldn't go in. She had to sit in the car out, right? And they would text her when it was time to come in. And I can't imagine that's going to actually stay. Maybe it will. I don't know. But it just feels like there's something that's not going to work there. What's interesting to me is the access control and visitor management type systems are extending now beyond the building, right? Where before they were, once you got into the building, that's where the access control kind of really started. Curious your thoughts on, does this mean now like the parking systems get into it? Is this actually an interesting way that home healthcare gets involved with hospital healthcare, where like you do some stuff at home to, maybe there's like it reminds me, like when I drive down the highways down in Florida, they would always have like the hospitals and would say, our waiting room has 20 minutes, right? Like they would have like a ticker. Like, does that happen now inside your house where you do some stuff and then you go, what are your thoughts on how security is expanding beyond the building?
Yeah, well, one thing I'll say, and just kind of to touch on the point there that you made, you're seeing a lot of different ways that hospitals are just being very flexible and adaptive to what's going on. So like you mentioned, the text messaging to let somebody know when a patient's ready, or when it's appropriate to enter the facility. As far as, yes, what you mentioned is kind of bang on. We're going to see a lot of innovations and just ways to kind of limit people being actually in the facility. I was involved in a discussion the other day where there was some talk around some of the home healthcare practice, some of the telemedicine, and leveraging digital platforms as well to help capture some of these things, so people don't have to necessarily come into the facility for certain elements unless it's absolutely required. So yeah, I think for the foreseeable future, though, we're going to see, if not the same, very similar restrictions until we have more answers around how we're going to actually combat this illness, this disease.
Yeah, I've been calling it we're entering in the awkward period, where the people are going to try a lot of things with good intentions, and there'll be some really good stuff, and there's going to be some bad stuff that comes from it. But it's all done with the desire to try to fly the plane and build it at the same time in a pressure cooker, really, of it's one thing. I spent a lot of time in the commercial real estate side, where people are talking about getting back to work, and there's somewhat of a level of control there, because it's office type stuff that you can kind of do at home and that. But like the hospital, it's mission critical. Like my father-in-law he runs facilities for a big hospital chain in the Northwest, and it's like he almost has to have like two brains, of like pretending that like this is not happening, but understanding that it is and operating, but then also thinking like, okay, how do I change what's happening? It's just, it's like a deep end of the pool overnight, that there wasn't like an opportunity, where I felt like on the disaster relief stuff that he was doing, there's a lot of people working on it. You'd have practice, and, and they did like a lot of active shooter stuff, where this is like, wham, you got to figure it out like overnight.
Yeah, absolutely. You have so much information changing, especially early on. Policies would be rolled out, policies would be communicated, and then sometimes the same day, some new information comes in. You have to change everything. So there's Yeah, and I think just these healthcare facilities have done a great job in being able to adapt and keep up with the pace of the change, because it's at the rate it was going. It's so easy for information to get missed, or and I've seen a lot of facilities doing a great job of just making sure that they're up to date with their policies. The staff know what they're supposed to be doing, and it's very challenging in the current climate.
Absolutely. So let me shift gears on you real quick, if you don't mind, on another topic that I think
Not
is
at all.
so. You mentioned you're in Hamilton, so just outside Toronto in the Ontario area. So I've been noticing there's a ton of blue flame thinking technology companies, people really in the Toronto area. What do you think? But it doesn't necessarily. It gets some, like some pub, and you get some noise. But I'm actually surprised that you don't hear even more of it. What is that? Is there like college university? Is it, you talk about it that it's a diverse city, so people move in there? What's your take on the ecosystem of, say, security, security industry itself in Canada, specifically Toronto, but then move beyond that, if you would, on the technology? What's your take on it?
Well, I guess as far as the technology is concerned, you're right. There's a lot of we have a lot of universities and colleges, not just in Hamilton, but in the surrounding areas. So I'm sure that's having an impact. I know in Kitchener Waterloo, which is not too far either, that was kind of our technology hub for a long time. I don't know that it still is, but when Blackberries were prominent, RIM had a ton of campuses there. I remember a part-time job I had was actually doing security at some of those campuses, and it was just so busy that on my days off from my full-time job, I could just call and say, I want to work this day at this campus. No problem, because they just had so much going on. It was just absolutely booming. So I think there is still an element of that. There is still an element of that here. And again, yeah, it is a very diverse community. Not just Toronto, but even expanding out my way in Southwest Ontario as well.
Yeah. Yeah, no, I see it. I spent some time there. I think you and I talked about it, and it's a wonderful city. It's got flavors, in my opinion, of like the DC area here, because it's like a big town, big city. It's like, I don't know. An interesting feel. And pretty diverse on that side. Very cool. So on you specifically, on your area, you're um active in the security. So do you see, like, what's good look like in the health security side? What gets you excited and motivated to be one of the leading experts in that area? And like, what's your feel on it, if you would?
I think I'll say some of the positive things that we're seeing that have kind of resulted from this pandemic are just the willingness now for people to get more digital with what we're doing and actually really leveraging technologies, because I feel like our industry has always been kind of slow to adopt some of these things. Like, I shouldn't say our industry, but our verticals specifically, because there's always, depending on the technologies, there's always issues with privacy and things of that nature. But I think good, because one of the other things, obviously, that's a big concern in healthcare is workplace violence. So seeing a lot of the work that's being done around that, and some of the legislation that's been coming out to help combat those issues, or at the very least support healthcare workers, I think is a great thing. But I guess as a security leader, good thing is, I guess what good looks like at the end of the day is everybody goes home safely, the job gets done effectively, and yeah, there's successful outcomes for everyone. I guess that's kind of vague, but it's really
No, that's fair. That's the honest. I mean, that's what I'm finding. I mean, that's usually what drives people in our industry to want to be in the industry, and then sort of that North Star. So that's totally fair. Question for you, totally out of the blue too. On this thing about, out of all the books that you have behind you, what's the most influential one, and the one that you would recommend?
I guess the most influential one for me is, pull up this one right here, The 360 Leader by John Maxwell. That was a book that I read when I was, before I was ever in a leadership role. And it really just focuses on, how you can be a leader without necessarily a title. So it really, there's an assessment that comes with it, and there's some really good ideas. There's actually one of the first books I read cover to cover. So I've had it for a really long time, but that's one that I would recommend. There's obviously there's a lot of books behind me, and a lot of them I've read, but that's kind of the one that sticks out.
Yeah, wonderful. Yeah, John Maxwell does a really nice job, and his books have been great. So, is there anything that you're looking for? Usually when I ask that question to companies, they're like, "Yeah, I want more customers." So, but the different on your end, yeah. Is there anything that you're out looking for, from a networking standpoint? It's whatever it might be.
Yeah, for me, I'm really just looking for healthcare security professionals, not even necessarily just leaders, but even frontline guards who want to improve themselves. I'm looking to just network with as many people as I can, share information, create community, just bring people together. And like I said, my podcast, I use it as kind of an educational resource for folks. I learn a lot doing the interviews that I do with people, and I'm really grateful to have the opportunity to share that with others. So I really want to get some traction for that and get that information out to as many people as possible. And also, I didn't mention this earlier, but myself and a gentleman named Mike Hodges, we're working on a second podcast that's focused on workplace violence called the Proactive Security Podcast, which is kind of based on his blog and the work that I've been doing and bringing it all together.
Oh, that's awesome. I'm thrilled that you're doing that, because that's actually, it's funny. It kind of dovetails with, we work with the GSD Talks team as well, and they're doing a whole thing around, they're calling it fails, but domestic violence and stuff. So it's in line with that too. Because what I'm noticing now is that there's this desire to have more of a conversation around, we say we want to keep people safe, but it's like, safe from what? So now having those conversations about what the things are that are, where threats are, to make that, because some of them are, not comfortable to talk about, right? Because they're very personal, but that ability to, whether it's bullying, physical, whatever it might be in the workplace, it'll be pretty interesting to have that. So you mentioned the podcast. If you don't mind, how can people get a hold of you? What's the podcast again? Because we'll get it out. We'll put it on here so people can see it.
Awesome. Okay, yeah. The easiest way to get a hold of me is, well, actually, it's super easy because my name is Brine, like it rhymes with nine, Brine. So my dad was the only other Brine Hamilton. I'm the only Brine Hamilton right now that I've been able to track down. So, so if you Google me, I'm on LinkedIn, I'm on Twitter, I'm on Facebook, I'm on TikTok, I'm on Instagram, I'm on all the social media platforms. So I'm easy enough to find. Just Brine Hamilton, or visit my website. It's brinehamilton.com. brinehamilton.com/podcast if you want to just go straight to the podcast page. But yeah, feel free to connect with me. I'm always happy to make new connections in this industry.
Yeah, you're super approachable. You're a great storyteller. I really, I'm thankful you and I got a quick opportunity to meet, and the connection through Sarah has been wonderful. And it's been fascinating. I think you mentioned it, like the ability to do these podcasts. It's mutually beneficial. The best parts that I get are like, you start to build relationships, you have conversations before and after and stuff like that. So it's a fantastic way to get to know people. So thank you for doing what you do. I look forward to the new podcast, because that's super interesting for me personally to get in, to understand that type of stuff. So I look forward to many more opportunities to do this, and thank you.
Thank you very much. I appreciate the opportunity to be on. And again, I love what you're doing. I'm happy to help however I can as well.
Thanks, Brian. Appreciate it.